Thank you. Again, yep, Rob Ryan with the Bowen Center. Thank you, Jerry, for the invitation to share a little bit about Bowen Center and a little bit about my story and my journey. I came to the Bowen Center in 2004. In fact, later I'll share at least one story about that. And I was an intern in counseling psychology, and I probably regret saying it now, but I remember at the beginning saying, I could do anything for a year. And apparently I've done it for 20 straight years at the Bowen Center. I kept staying there. When you find something good, you certainly want to keep it. So we definitely want to share that with you today. Thank you for that. I guess what I probably would like to do is to just share a little bit about the Bowen Center, share a little bit about my journey in leadership. And like Jerry said, if you leave here having met someone new, maybe something strikes you, that's great. If you hear something about the Bowen Center, either for yourself or others, you say, hey, you should go check that out. I figure that with all of us, that would be a win. So let's just kind of get into it here. If you go to any of the community mental health centers around the state, you'll often see this picture. Right? This is a picture of John F. Kennedy signing, unfortunately, the last piece of legislation he signed before he was assassinated. It's called the Community Mental Health Act. And I have to say the fact that he signed this, it means a lot to us in the community mental health arena. And probably the most important reason is that he grew up surrounded by people with mental illness. It could be his wife, Jackie Kennedy Onassis. Her maiden name was Bouvier. She had an aunt and a cousin who had schizophrenia. If you ever have the time, there's an actual documentary on Netflix called Grey Gardens. And if you watch it, it's just a reminder that it doesn't matter how much money a family has, it doesn't matter how much influence a family has, mental illness will touch us in some way. And of course we know that John F. Kennedy was surrounded by mental illness. He had addictions issues in his family, and he also had mental health issues in his family. So what we're going to really talk about here is how Bowen Center started for a little bit. It was started basically as a community effort in response to several of the commissions that were started throughout the 50s and 60s that led to the Community Mental Health Act. Community members got together and just sort of said, you know what, the way that society treats people with mental illness has to change. There needs to have some way to treat people here in the local community, and we need to do that. You see, John F. Kennedy knew something about mental health, and it was that he actually said, future generations are going to judge us how we treat the marginalized, the less fortunate, and we're not doing a good job. And by that, it would be in the 1960s, if you had a serious mental illness in your late teens or early 20s, you packed a little bag and you went away to a state institution and you basically stayed there till the day you died. And we believe today that the best place to treat people with mental illness is in the community. There's a whole other talk I have about how important it is for people not just to live in the community with a mental illness, but how society benefits by having people that are different. Too often we think that by having people not in state institutions that we're doing something good for them, not realizing that by living next to people, interacting with people with mental illness, it does something for us. And when you send people away and you keep them all together in a state hospital institution, I think society was missing out. So again, very proud that John F. Kennedy was part of that. I think he understood, and really it was a big part of what the Bowen Center has become. There are 24 community mental health centers in the state. There used to be many more than that, but through consolidation and a short story I'll tell later, there's fewer of those. We started in 1960. If you kind of do the math there, it's like, well, it's before this. Trendsetters at the Bowen Center, right? It really was this idea. It was local individuals. There were a few doctors, but the rest were just lay people. Right? They didn't know anything about mental health. We started in 1960, opened our doors in 1961. Back in the day, you were assigned counties. And so Bowen Center was assigned 4 counties. They were assigned Marshall County, Kosciuszko County, Whitley County, and Wabash County. And they must have paid a lot to an advertising company because they came up with our name, which was 4 County Community Mental Health Center. Bravo. Bravo to that. Several years later, we added Huntington. They went back to the same ad agency, and we became 5 County Community Mental Health Center. That was really sharp. We were really sharp. Mad Men, remember, they had the greatest ideas back in the 70s. And then late in the 1970s, we were named after a 2-term governor, a big supporter of mental health, and we became the Otis R. Bowen Center for Health Services, Inc. And so you can understand why in the 1990s we changed to the Bowen Center. Well, we love Doc Bowen. That name was a little bit long. So we have grown a lot. When I came to the Bowen Center in 2004, we had around 200 employees. We were in 7 counties. Today we have well over 1,300 employees, probably around 700 clinicians. And thank goodness we use a different ad agency because we'd be called something like a 30-county community mental health center. So I'm glad we moved on from that trend. All right. So part of what I wanted to share with you today is something that I learned, something that I depend on, and I thought I'd do really 2 things. One, I'd share a book that has been helpful to me, and I'll share a few things from that book that has been helpful. And then the second part, really getting to what Jerry was talking about, is there something I've learned along that journey that I can share with you that might be something helpful. So Vern Harnish here wrote this book called Scaling Up. It's really focused on the Rockefeller principles, the 2.0. It's that Rockefellers, right? And the real focus of this book, which was so helpful to me, is that it's really a purpose is to help companies that are going through change. And that's definitely what Bowen Center went through. You can imagine 200 employees to 1,300. That's a lot. The 4 things that it really has that it focuses on is people, strategy, execution, and cash. When it comes to people, your challenge is you have to build a strong team and align everyone towards the company's vision. Strategy is you have to craft an effective and clear strategy. Execution, you have to create strategies that are effective and efficient. And of course, with cash, you have to make sure that you're managing your financial services as well as possible. Again, not uncommon for other companies, and that's part of the reason why I wanted to share it today with you, because I do think it's similar for most all of us. So what happens, though, in this book is they really talk about those 4 things, but I'll focus on 2 of them. The first one really is about this idea about execution. Something that the Bowen Center has gone through, I talked about, was a lot of change, is something that Vern Harnish would call companies they call start up, scale up, and then screw up, right? That's what happens. And you might say to yourself, well, I thought that's what happened to venture capital companies or companies that are new. No, any company that goes through change, that can happen to. And that happened here to Bowen Center. Just one of our most recent was the addition of physical health. And so we're going to share a little bit about that with you, is how do you go through change in your company and make sure that at the end of it, you don't have screw up. And instead, much like this little picture, you just go from fishbowl to fishbowl, larger and larger. So I figured the easiest way to do that is I'm going to basically, instead of just using Bowen Center, I'm going to come up with a little company of our own here, and we'll walk through it. So you really have these 3 stages, right? You have that startup phase. Startup phase is innovation, trying to get something to the market. So let's say, for example, someone says to me, oh my gosh, I love your brownies that you bring to a potluck. Where do you get those? I say, that's my grandma's secret recipe. So you should sell those, right? Has anyone said something like that to you? So in a startup phase, I think to myself, you know what? I think people would buy my brownies. What I would be focused on is, how do I get these brownies to the market? The 4 things that you need to focus on during that phase, and we did during this phase with physical health, is number 1, innovation. Just thinking to yourself, is this a problem-solving idea? People are hungry, they want a snack. And can I repeat that over and over, right? That ability to repeat it over and deliver to a person is something that's important. I think to myself, yeah, everyone says they love my brownies. I'm going to give it a try. But the next is risk-taking. Oh my gosh. I mean, I have to put $10,000 up front in order to do this? Well, okay, this is getting real now. Grandma's brownies better really sell. And these people who say they love them, they better be able to pay for these things instead of just talking about them. So the next thing that you have to talk about is resource constraints. Oh my gosh, where do you get a 40-pound bag of flour? I mean, I can make them with a little bag I can get at Meijer's or Kroger's, but where do I find that? And then certainly the last one there is a sense that there's a lot of uncertainty. What if people don't want them? What if someone gets sick eating one of my brownies? Oh my gosh, what am I going to do? Well, inevitably, our company does well, starts selling these brownies. People love them as much as other people say they do. And so you enter into that next phase, which is that phase of Scaling up. And we certainly did that. We moved into physical health care, and we moved into physical health care for this simple reason, right? Is that about 10 years ago, an article came out from the National Institute of Health, and it said that people with mental illness, if you get a serious mental illness in your 20s, you're going to die 20 to 25 years younger than the general population. So here in this country, it's around 80 years for females and about 77 years for men. So we're talking, you have a serious mental illness in your 20s, you're at basically midlife at 30, right? 25. And that really just resonated with me. It's like, we have to do something about that. And so when we looked at what contributes to stealing those years from people, almost all of them were contributing to having a mental illness. Living in poverty, obesity, the medications we actually use in order to help treat individuals, access to care. And so while all those things contributed to stealing years from people's lives, there was really one way that you could return most of all those years, and it was integrative care. And so you think to yourself, it took us almost 60 years in order to include physical health care. Well, why did it take us so long? Right? Only about 2 or 3 of the community mental health centers even deal with this. It really comes down to funding. But the cool thing about this is it really, if you go back and look at that Community Mental Health Act, it was supposed to be for total health, is what they called it back then. Integrative health, as Jerry said to you, is not just including physical health care and putting them in the same building as mental health. It's a individual level and a macro level coordinated care for individuals. It's understanding what contributes to those things that steal those years and say, we're going to work together to help you navigate this complex physical health and mental health world. And I can tell you proudly, we're already seeing some of those years return to people. So back to our brownie company, right? Proud of the Bowen Center, but we're here to talk about brownies, right? All right, so in that scaling up phase, right, and this could be your company, you end up finding yourself saying, man, we have rapid growth. I can't believe this. Last month, we ended up selling 10,000 brownies, but the month before, we only sold 1,000 brownies. You start thinking about operational efficiencies. You know what? I wonder if we could take the flour and the eggs and the sugar and put them all in together and mix them and skip 2 steps, right? So, right, let's try it. Next one is market expansion. Hey, what if we brought a blondie on and we could double the amount of brownies we have, because some people don't like chocolate. I mean, they're kind of messed up, but some people don't, right? And then, of course, you need strategic planning with that. And the strategic planning with that is something like, man, this was supposed to be a side hustle, and now it's taking up so much of my time. I better get someone to help me run this business. So whether or not your company is new that you represent here today, whether or not it's been for a long time like ours and you're entering a new thing, you can kind of see how this cycle goes. And this book is really great at helping you move through those different places. But as you know, we said there's not this larger bowl, there's a screw-up bowl. So what can be those things that could trip up our brownie recipe, or our brownie sales, or what could it be that something's happening here with the Bowen Center to trip us up? And I'll be honest, I'm glad that some of the people came from Bowen Center, because I can't lie. We certainly tripped over some of these. It could be poor decision making, right? It's this idea of saying, let's go ahead and sell a blondie, and they don't sell. Nobody told me they like Granny's blondie recipe, and it's for a reason, because she puts, I don't know, cinnamon in it. Who knows? Right? So no one really wants to buy those. Or it's market shifts. Oh, great. There is a famous person and they've got a new weight loss thing, and it's to cut out all sugar. Well, shoot. Our 10,000 brownies, we're back down to 1,000 brownies. And then, of course, there's operational failures. Remember that deal we signed with Walmart for 100,000 brownies? I only have 10,000 brownies to bring to them. That's a real problem, right? But something that I would give you that the book really focuses on is that all of these things should be something that you can learn from. And it's humorous, the start up, scale up, and screw up for that very reason. If you can learn from your mistakes as you're going, totally worth it. Go ahead and do that, right? So after that, I want to talk a little bit about, you've heard, we're pretty proud of what we do at the Bowen Center. We've grown. We're actually the largest community mental health center in the state, but we didn't do it like all of our services for that. We put our head down, we're doing what we do, we're meeting the community needs, and we looked up and, wow, this is amazing. This is amazing what we're working with here. When it comes to sustained success, I don't know that there's a better example than this guy, Gary Kasparov. At the age of 17, he basically became a grandmaster champion, best chess player in the world, and stayed that way for the next 25 years other than a few weeks. You may remember he also played against Blue, the IBM computer. He lost. He was very upset with that. But I think we're ready to admit computers are smarter than us. But he didn't take that too kindly. But in an interview, he talked a lot about what has helped him maintain that level of success. And I would argue it's true about Bowen Center, and it should be true about your company. This idea about how do you make sure you continue that cycle of startup, scale up, success, going from bowl to bowl. And he basically says the gravity of success, or you could argue winning, creates an illusion that everything's fine, that after victory we want to celebrate, not analyze. Bowen Center had patience yesterday. We're going to have patience tomorrow. We did well yesterday, we're going to do well tomorrow. But in our world, you need to win people's trust and their business every single day. And you have to remember that someone out there is trying to figure out your brownie recipe, and they're trying to take what it is that you have. And if there's something special that you do, which I do think something is special at the Bowen Center, it really is our people, it's not so much our philosophy, then you should feel responsible for making sure that moves forward. And that's something that weighs on me. The Bowen Center had been here for 63 years before I came along. Right? And I think to myself, I want it to be here for my kids and my grandkids, whether or not it's for jobs or if they need mental health services. So we really want to focus on what does it take then to have continued success. Just another, maybe a little more contemporary example is yesterday's home runs don't win today's baseball games. So there was another community mental health center back in the day that held the position that we do. It was called Madison Center. They were in South Bend, Indiana. They were the largest community mental health center in the state, highly influential. People looked up to them, right? They had a great brownie recipe. And one of the things that they wanted to do was they really wanted to sort of expand their footprint. So they took out a lot of bonds and they built a lot of beautiful buildings. And as you know with bonds, it's a little bit like student loan debt. What is that? You got to pay it back someday, but no one tells you, right? So maybe no one told them that you have to pay this back one day. Well, they had quarterly bond payments. And a quarter of bond payments came up, and wouldn't you know it, they said, can't pay it. So they called down to the state, and they said, listen, you got to help us out. We have a bond payment, and we can't pay it. Something to know about those 24 community mental health centers. We're not government agencies, we're not-for-profit companies. And 2 weeks after that request, I was in their offices as they were taking furniture out from bankruptcy, trying to hire as many people as possible. So we take this seriously. To sit back and go, we're great, we're awesome, misses the point. And it also is why we're always trying to reinvent ourselves, doing something that's different, doing something that's new. Even not in our industry, maybe not in healthcare, I thought I would share a story that maybe makes a little bit more sense to you. I brought my welcome kit from Blockbuster. It's a little bit of a lie, I bought it on eBay. This is Sharon Anderson, wherever you are. Thank you for selling me your card. Do you remember one of their ad taglines was, let's make it a Blockbuster night? Yeah. If I said to you, oh man, I am so looking forward to watching a movie tonight, I'm going to go hit up Blockbuster and get me a DVD, you'd probably think maybe I'm a time traveler going the wrong direction, right? VHS. That's right, VHS, even better, even better. So we're going to talk a little bit about Blockbuster and what happened there. And even if you've heard about it, I have a story to share from someone who was in the middle of it. I went to a conference and there was a guy by the name of Bill Levison that was there. And he was in the thick of this back in the early 2000s and watched Blockbuster, what happened to it from the, maybe not inside, but from beside. See, Bill Levison was the senior vice president for sales for Coca-Cola in North America. And Blockbuster bugged him. It was the only national account that still sold Pepsi. So for 1 year, 2002 to 2003, he bugged the CEO of Blockbuster. Come on, Pepsi, really? Right? My wife would not be happy that I said that. She's a Pepsi fan. But for Coke, come on. So finally the guy said, you know what? We're going to do it. We're going to switch from Pepsi, and we're going to switch and take you up on your offer, and they were going to switch to Coke. So they decided we got to find a way to celebrate this partnership. Let's do this. Let's go to the best steakhouse in Dallas, Texas, and we're going to celebrate the synergy between our companies. Great. So they go there, and all their brass were there. The CEO walked up front and got everyone's attention. He was holding a $250 bottle of champagne, and I looked at the crowd and said, listen, I just want to tell you something. Blockbuster, 5,000 stores here in the US, 9,000 stores around the world. Let's make it a Blockbuster night. Oh, everybody cheered. He goes, oh, wait. Just want to tell you something. Coke, you've been around for 100 years. Thank you for your partnership. We're going to be around for 100 years with you next as well. Big cheer. So then got a little cocky. Said, oh, by the way, you heard of these people, Netflix? And they all said, boo, boo, Netflix. He goes, can you believe that they went public this week on the NASDAQ and they're out there trying to say that they're going to be better than us? See, back then, Netflix was not the streaming service we know, right? If you're back then, you'd go onto your queue and you'd say, ooh, Titanic, I'm going to move that to number 1. And you waited 4 weeks until one version of Titanic was, they'd send it to you. You'd watch it, you'd put it back in the mail and send it back to them. So they're understandably laughing at them. Now, even if you're not an economics major, maybe you're not in finance, I think this next chart will be self-explanatory. If this was your retirement portfolio, and I said, which of these lines do you want? You don't even need numbers. You'd be like, I'll take the green one. The ironic thing is 3 times in the early 2000s, Blockbuster had the chance to purchase Netflix. In fact, the first time Netflix approached them and said, take us. And they said, no. The second time they came to them and said, I see you're starting a mail DVD, and send through the mail DVD program. We'll run that for you. No. And then the last time was basically the last venture capital cash they had. They approached them and they basically said, Netflix said, no, we're not going to do that. They really didn't understand what Gary Kasparov was saying. There was a sense that when you're on a high, we got it. We got it. But what I really contend to you is that's the very time to be starting to think to yourself, someone else is trying to understand our business. Someone wants to take our business. And if you have something unique like the Bowen Center does, you should protect that. Right? You should protect it by staying in front, innovating, making sure you're bringing something different to the market. And this is really a big part of, in addition to meeting our patients' needs, of why we have continued to change over those years and why we grew. Not just to say, you know what, we're the largest community mental health center in the country. I was half expecting a laugh from at least 5 of you when I put this slide up here, but no. That's what they want to raise. This is my CFO. Right? And you can see when I did it. And I have to say, something I've learned in this position is finding key people around you that are good at what they do and have integrity. And I would say, never met someone more so than that here with Jay Baumgartner. See, remember I told you I started out in 2004. I was a director of accounting. I started doing some work across our system and then became essentially the chief operating officer. Well, that came about because our CEO at the time said to me, you know what, I think I'm going to retire here in about 5 years. I'm going to talk to the board, we're going to do some interviews, and if you are selected, we'll do a 5-year transition plan. And usually when I used to tell people that while it was going on, there was almost pity. They're like, 5 years? Like, how are you going to survive that? I think our personalities were well matched, and it was successful, but during that time, there was still this tension of this vision that we had from before and this vision that I wanted for the future, bringing integrative care in addition to physical health, dentistry, optometry, chiropractic services, and pharmacy. So one day I went to go see Jay Baumgartner and I was telling him this vision of what I wanted to do, and much like our buildings that are over there in Whitley County that's new, we're building a new one in Marshall County, and one that's coming after that is there in Kosciuszko, and several that are planned here for Fort Wayne. Jay looked at me and said, so let me get this straight. In 5 years, you're going to take over from a CEO that's been successful for 30 plus years, and you're going to say you want to spend $50 million. I was like, okay, I can see the folly in that. We have to have something that we're doing to show them that this is a good bet, this is a good direction to go. And even though I had been there for 20 years, they will have known me. That's kind of a bold statement to say, like, we're going to spend $50 million. So the other thing that I learned about that startup, scale up, avoiding screw up, is really being able to paint a picture, a simple one that everyone can rally around and say, oh, I get that and I can do that. You know, numbers and finance, that's not everyone's deal. So something that he came up with was a pretty simple accounting term, which is just days cash on hand. You sit back and you look, how much does it cost me to run my business for one day? How much cash do I have divided into that? And that's how many days you could go without any revenue. So at the beginning of that, we were sitting at around 120 to 125 days cash on hand. Different auditing firms would say 120 days cash on hand. That's healthy. But for Jay, he's like, you know what? I think if you can get this up over 180, I could support that. And any money over 180 days cash on hand, that's like house money, and I think it's worth it. So we set off to really create that cushion in order for us to be able to do that. And I'm certainly proud to say that 125 days turned into 234 days today, and we're over $10 million into that project. In fact, Mista's here. We spent almost $10 million on just her building, which that's great. But the question really is why are you doing that? Are we sitting back like Gary Kasparov and celebrating? Or is it a trophy? Or is it, hey, let's do something different? You know, the people we work with, we're a safety net organization. We will see everyone. If you have private insurance, we'll see you. But really, if you have nowhere else to go, you have no way to pay, you can come see us at the Bowen Center. You can come see us. In fact, many of our people, those who are self-pay, in fact, the majority will pay nothing. They will leave with no pay, no bill. The deal ends up being is, I don't believe that there's a lot of good things that people can be proud of in their life from a physical standpoint, right? They have family, they have other things that obviously that are great for them, but I think that Lutheran Hospital is beautiful, right? And I want our location that's tailored for them to be just as beautiful. I want them to walk in with a sense of pride and say, hey, we respect you. And we want to move them from the shadows, our offices that were often hidden and sort of back and away places, out to the highway, because we think, you know what you do here, what you do to change your life and to improve your life is worthy of being seen, and you shouldn't be embarrassed of what you're doing. So we set out on that goal, and we certainly were proud of that. So whether or not you pick up the book, I don't get a commission for it. It's certainly not a problem, but that is the two things that I would argue are the most important things that I found about that. Again, from the strategy standpoint, and also I would say, Jay would kill me if I didn't say it, he always says, cash is king. That's it, cash is king. So next up, as Jerry said, is there anything you learned along your way, right? It's not from a book. What did you learn? I'll tell you that when I first was selected by the board and I had this 5-year transition, the CEO job wasn't open, right? So I had to do something. I'd already been in operations, but essentially I was promoted to the chief operating officer. And if there's something I've learned about myself over the years, I can be a little impatient. I want to get it done now. Come on, let's go. And if you're saying things like, well, let's plan, let's write down what we're going to do, I'm like, why? Let's just go. So now that I was in that position, I'm like, let's just do it. Let's just fast. That's what we're going to do. So off on the way, we started changing things. And certainly at the beginning, people loved it. Get rid of bureaucracy. Don't have to write things down. Instead of plan, do, review, it was sort of like, you got an idea? Go, right? And certainly at first, that's, a great thing. But something happened along that way that started gumming up the system when you have projects like that aren't finished, that don't have polish. You got Philip Zimbardo. He's famous from Stanford, from the Stanford prison study, but he had this social idea about how we interact together, that we take cues from each other on how we're supposed to behave. James Wilson and George Kelling came later and turned some of what Philip Zimbardo's study was into a theory that he called broken window, the broken window theory. And you may not be familiar with the theory itself, but I do think you probably know its most famous application is it was used in New York City, right? Police Chief Britton and Mayor Rudy Giuliani at the time inherited a city that certainly was barely a reflection of itself from the 1950s and 60s. Sort of seedy, lots of crime. And they brought these two in to say, is there a way to fix this? And they used their broken window policy or theory in order to fix and change New York City. So what was that about? Well, they coined it. It really is a metaphor. I suppose you could have called it the jaywalking theory or the public intoxication theory. They talked about these broken windows as something that's left neglected. There's a law against broken windows, but if you don't follow it up and make sure that you say, hey, you have to make sure that you can't have a broken window. Here's a citation. They found that it sends a message to the world, which is we don't really care, right? Especially in the criminal world, it's like, hey, here's a place that we can maybe take advantage of. And not to oversimplify it, it wasn't just as simple as New York City cops went out and wrote tickets for broken windows, but it really was a whole community effort that said, you know what, we're going to change the perception of this place. And we're going to say no matter what your building is, where it's at, you're going to take care of it. And if there's a law in the books, we're going to follow through on it. And there certainly was a lot of change that you saw happen there. So I'm sitting here thinking to myself, is this possible that I could see this broken window policy and see what was going on here at the Bowen Center? So I started thinking about that, and I thought, the beginning, I kind of liked it. I said, hey, let's challenge status quo, let's do things differently, let's just go ahead and try something. If it doesn't work, drop it. If it does work, keep it, go on to the next thing. But when you're doing that, occasionally you'll break a window, didn't write it down, somebody didn't know we made a change, someone came on later, they didn't get trained, another broken window. And people start seeing these broken windows, and it starts sending a message, I'd argue, to a company that says, you know what, you don't have to do world-class work here. You can just do good enough. So I was telling Jerry earlier today, I came, parked in the wrong parking garage. I came out, and what Jerry described where this place was, I'm like, this doesn't look right. And a lady came up to me and said, you look lost. And I was like, my face says I look lost, that's good. So I said, yeah, I'm looking for this auditorium. And she's like, you have to, you know what, come with me. And I was like, okay. So I was like, it must just be inside the door. We went in the door, down a long hallway, down another long hallway, down a corner, around a corner, up some stairs, up an elevator. I was like, I can't believe this lady is coming all this way. In my mind, that's world class. You're not going to be on my campus, and you're not going to be lost. I'm not going to pass you. I'll take you to the registration, and they can tell you where to go. But that's not what was happening at the Bowen Center, right? I started saying, you know what, who cares? Let's go speed. Well, here's the deal is, you can do that for a while, but I was starting to notice more and more broken windows. And I was responsible for some of those broken windows. And this system that I would argue that I inherited that was a good system, that was solid, while people, again, were applauding, oh, man, writing things down, waiting till we have the best plans. Psh, that's old school. New school, just do whatever you want, whenever you want. Now, you might think we're describing the Wild West. I don't think it was that bad, but I definitely could tell that things were changing, and my skill set in operations was part of what that challenge was. And so you have to be able to spot those challenges and say, okay, I have to do something different. So when I started thinking about that broken window policy, I'm like, I'm not so sure how that can be translated to people. Like, all right, everyone, we're going to do better at the Bowen Center. I'm going to use a policing theory to fix things here. I'd be like, great, I love working at the Bowen Center. We're going to have a policing theory to change things. So instead, I thought to myself, you know what I'm seeing here is that I'm seeing jobs being finished to like 95%, not 100%. So one of the first places that I noticed that was in our facilities department. So we would be building new buildings. We were doing them faster than ever. And I would go there to see this new building, and I'd tour around. The floors were great, the paintings were great, and there were like no pictures on the wall. Kind of looked like an institution. I'm like, where's the pictures? If a fixture in the bathrooms went bad, they would just ask the vendor, well, whatever you have, put it in there, whatever. If the HVAC system went down, what do you got? Put it in there. So then you started having a facilities department that had all these systems that they had to know, not one. And you had these things that were built well, but didn't really look attractive. Remember back to that whole thing about respecting our patients? I certainly believe in IT and the way it can improve our world. So IT was another place I found that. We had an IT learning lab we wanted to build. And so we wanted to get together, and we did want to do it quickly. So after I was told it was done, I went down there to look at it, and it was kind of a mess. Cords were everywhere. There was leftover boxes from the installation there. So I went to got the VP of IT, and I just said, hey, tried to introduce the idea about 95%. And understandably, you'll probably get this if you try to go back to your place and do this. It's sort of like, do you know how hard the 95% was? You know what? People don't understand how hard it was to run these wires to the wall, to find matching computers, to get it all set. They all have to log in. They all have to be synced together. Why don't you give me credit for the 95%? And after we sat down and really talked about it, we're like, you know what? It's the end user here that matters. They don't know about the wires in the wall. They look at this install and they think to themselves, low quality, probably low quality system. And you're being judged by that. And it may be unfair, but that's probably like most of our jobs, right? Most people don't know what we do. And if you finish things to the 95% threshold, you'll get judged on that last 5%. It is hard to do the 95%. I'd argue the 95% for people who really know their jobs, that's the tougher 95%. So my VP of IT, fine, he would call, he says, all right, I get it. Rob Ryan wants a bow on every project. I said, whatever you want to call it, put a bow on every project, right? Now this isn't our installs, but I would give you this example just so you can see a visual here. I would argue, great, computer works. This could be in one of our offices, and it's like, great, but guess what? 95%, right? 95%. This would be 100%. And for me, as a person, if I'm going into this office and I'm sitting there to talk to one of our therapists, this communicates something different than that, right? It just does. So this is what you say there is 100%. Now, you talk about on stage, off stage. Some of us use those terms. On stage would be any area where you and your customers go together. This is an on stage. But you could say, whew, you can have a junk drawer, right? Oh man, you've got a junk drawer. Nobody sees our IT closet. That's off stage. But the deal is, off stage or on stage doesn't matter. It's your people that we're talking about sees those broken windows. And so the one on the left works, could be the most newest IT system they have. But the one on the right, if I walk by there, I don't know what it does, but whoa, man, we really go to that 100%. And that's something that I really learned during that process, is this idea about, you know what, even if your strengths are not always tailored exactly to your job, right? For me, I would have said, I like doing vision, you need to surround yourself with those people who can help you do that. Because believe it or not, I wasn't even the first person to recognize this. The system started feeling a little uncomfortable. We started having people saying things like, no one told me that, or someone told me something different. And we're really still trying to work on that. It doesn't mean you shouldn't sort of push back against the status quo. That's fine. But if you think to yourself for 1 second, you're going to go through that start up, scale up, and avoid screw up by saying, let's throw everything out the window and let's just go, forget Granny's brownie recipe. Let's add a little more sugar and see what happens, right? We're like, quality control. You know, didn't we wash the bowls yesterday? That should be fine. Let's just keep going. But I don't want one of those brownies, right? And I'd argue you wouldn't want the Bowen Center if it did that as well. So that's certainly one of those things that we did, this idea about pay attention to the details. The next one is one that's definitely personal for me, is this idea about authenticity. I think in our world today, what people want more than anything is for us as leaders to be ourselves, whether or not you're in a senior leadership position or you're in a position where people just look up to you. I would argue that lady who walked me down here today, total leader, don't know what her job is, but leader. She showed me what this place stands for. If you read most leadership books today, though, it really is a description of how to be the best Lencioni or to be the best Jack Welch. But I would argue, from my experience growing up and going through companies, I want you to be you. But sometimes that's hard, right? So remember back in 2004, I told you I came as an intern. They wanted me to do work with mostly children and adolescents, did a lot of testing. And when I thought back to those times when I was that age, I thought to myself, you know what I really wished is that parents understood me more, used my language, weren't so square. So I thought, you know what? I got an internship. I'm only going to be there for 1 year. So I'm going to make sure I can speak their language and hang out with them and be cool. So I started getting the reputation called the skateboarding intern. Sure. At lunchtime, you'd find me out at the skate park trying to perfect a trick because I knew the kids I worked for, right, as they came in, they'd respect that. Even if it wasn't really good, they go, hey, you're trying. That's great. So no big deal. Remember I told you I only have to do this for 1 year? Well, it doesn't take very long working at the Bowen Center before you think to yourself, maybe I want to stick around here. And I got offered a job at the end of that internship to be a therapist. No problem, right? I'll be the skateboarding therapist. I'm sure I'll still work with the same individuals. So I started my career as the skateboarding therapist. And wouldn't you know it, life has a funny way of doing things. Is 2 months into that, the director of that county was stepping down, and she came in and said, I'm recommending you to be the next director of this county. Uh-oh, reputation crisis. 2 months ago, I was the skateboarding intern, and now I'm the skateboarding therapist. These guys are not going to respect me. Young, they don't think they're going to take me seriously. So I'm like, I got to do something different. I have to show them that I'm a mature leader and that they can believe in me. Now, something about me is that I absolutely love baseball. And so we piled in the car and we headed to Chicago to go see the Chicago White Sox play the New York Yankees. You might be thinking, is this what you think of your staff? No. I still wanted to be hip, so I wore a t-shirt with essentially this picture on it. I was tempted to wear it today. I didn't, and it was literally had words on it. Got it from Kohl's, Kohl's, it's edgy. It said, hanging with my homies. So I get out of my car and I'm like, hey, I'm here to hang out with you. And I still hear about that, hanging with my homies, when I go back to Marshall County, which is good. So we go into the stadium. We all sit on this bench. And if you know anything about the White Sox outfield, they have a weird bleachers where it's about 8 inches of a step and then about 10 feet back. And I remember I told you I love baseball, but I'm trying to be the mature leader. So I'm sitting there with the 20 people, and it's batting practice. Balls are coming and landing beside me like, I could have caught that one. Oh man, oh my gosh. I'm like, you know what? I'm going to be still respectful, but I'm going to catch a home run baseball. So I stand up and I'm like, hey guys, I'm going to catch a home run baseball. And they're like, okay. I mean, I don't know what they were expecting from the skateboarding intern, but I did give them a show. So I go over and I'm sitting there, and if you've ever played baseball, ball goes off the bat, and I was like, this ball is coming for me. You know it. So I'm on one of those risers, and I start going back, 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 back. And while I played high school baseball, I had never caught a major league home run baseball, and it was going much faster than I expected. And so as I was running back, 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 boom, all of a sudden I ran into basically what felt like a brick wall, crumpled to the ground. Now you might think to yourself immediately, you're thinking, oh my gosh, what is all those individuals thinking? But no, in that moment I was just thinking, what in the world did I run into? I mean, what is that even possible? So as I sort of opened my eyes, because of course right before the ball came, I put my hands up, closed my eyes. I was like, what happened? I turn around, and probably one of the largest human beings I've ever seen, probably 6'5", 6'7" guy, 275, 300 pounds, had my baseball in his hand. He was going, yeah, yeah, yeah. And then it dawned on me, oh my gosh, my staff is sitting right there, and now they're definitely looking at the skateboarding intern. And I said something to myself, just in my thoughts, it happened so quickly, and it was, this can't get any, what do you say? Yeah, so the universe heard that, and it said, I bet you it can. So I'm sitting there, and I'm thinking to myself, now I'm done. I'm like, this is embarrassing. Oh man, I'm the skateboarding intern. I'm young. They're not going to respect me. And I'm just sort of sitting there thinking, what's my next action? And I look over, and two gentlemen were sitting like right here. So I have 20 of my staff, and then two gentlemen were sitting right there. And they're looking back around, and this guy's looking and watching what's happening, and he's just disgusted. You can just tell by his face. And so he just points to this big, tall guy, and he goes, give that little kid the ball. And I just sort of like picked myself up, and I just went over and sat down, and I just said to myself, you know what? Life is like that. If you think that you're going to pull off, for me it didn't even last one afternoon, that you're going to pull off being something you're not, it's not going to work, number one. And number two, they weren't really asking for that. I felt like I needed to do that but in all honesty, the best way to be successful in leadership is to be yourself. Now, it doesn't mean that you can't grow and mature, but if you can't embrace who you are and realize that you were selected for your characteristics, lean into those, be who you are, then you will be found out. And arguably the way to solve most business challenges is to have a great team around you, be able to train, be able to grow together, and you can't do that when you're fake. You might be able to pull it off for a while, but we've all probably can think about some of those bosses where you're like, when the chips were really down, they showed who their true colors were. So if you're not lying who you are or trying to fake who you are, you don't have to try to remember in those circumstances. Now, what would the mature director be? How would they act? And so authenticity is absolutely, for me, one of those lessons that I learned. I'm actually glad that I learned it pretty close there. Now, I didn't fast forward through the slides quite so well, but there's my little Sandlot reference. Thought I'd catch the ball, and this is what it felt like, essentially. That's where, this is them all staring at me. All right, last thing that I'm going to share here is this idea about delegating like a boss. There are three things that happened during John F. Kennedy's presidency that maybe on the surface don't seem that they go together. 1961, he had the Bay of Pigs disaster. In 1962, there was the Cuban Missile Crisis. In 1963 was his assassination. So Bay of Pigs, simple in this way, I'll simplify it, where essentially there was this theory that to overthrow Castro, to remove communism from being so close, less than 100 miles to the shore here in the US, was to overthrow him by training 2,000 Cuban soldiers. They would storm the beaches. The Cubans would see them there, rise up, and overthrow Castro. Did not work that way. But before he said yes to this, he sat down his whole cabinet, and one by one said, good idea? Yup. Good idea? Yup. Every one of those people around the table said, good idea. It goes very, very badly. Another quote that John F. Kennedy said that I love, which is, success has many fathers, failure is an orphan. So he brings that same cabinet back around and says, what happened? I mean, I wanted to say that was a bad idea, but everyone else said it was a good idea. So every one of them said the same. I had reservations, but everyone liked it. We know that today as groupthink. But the reason I'm sharing that story is after that, the head CIA agent assigned to the White House slipped John F. K. this poem by Daniel Ortega. And as you read it, you might think to yourself, yeah, people don't understand me. As a leader, like, you're right, I'm the only one who understands. But there's more to this story, right? 1962, Cuban Missile Crisis. He now has this poem in his pocket. And that's actually, in my mind, a really good thing because there was a lot of people telling him what to do during the Cuban Missile Crisis. Again, super shorthand. Khrushchev, the leader of Russia, thinks, what am I going to do about intercontinental ballistic missiles in Western Europe that can destroy Russia? Let's put missiles in Cuba. Didn't take very long before U.S. spy planes found them, and now we have this Cuban Missile Crisis. Many argue the most existential threat to human existence that we have ever faced. So essentially, he had people saying, storm Cuba. He was probably thinking to himself, try that before, that's not going to work. Others were saying, do nothing. He chose embargo and then to reach out to Khrushchev, and they both understood that there has to be a way out of this to save some face. And he actually stated about this poem that it really made a difference. And so when you're delegating things, here's what I want you to see is, this is a basket of tomatoes, right? We all agree with that, but they're different colors, are probably different breeds. And there's a secret to delegating, which is this. If you're going to turn it over, and you think about that poem, you're thinking, yeah, only people who are in the job know, so I need to tell people exactly what to do and how to do it. But I share that poem with you because it's hard to remember that the people who are going to solve your problems are bullfighters in their ring. And it's very tempting sometimes to step into that ring. But to delegate successfully, a little John Wooden quote there is, so often people get praised for just being busy. But if you want to delegate well, you need to set out for him, I need you to accomplish this. And then I'm okay with how you figure that out. Oh, it's tempting for control freaks to step in and go, hey, let me tell you how to do this. It's hard if you watch them and you think to yourself, this is going to fail. But let me tell you what happens when you do that. At best, you're going to be seen as a micromanager if your intervention works. More than likely, though, you'll create an environment where instead of people trying to innovate or do something different, you know what they're thinking? What would Rob do? And honestly, you don't want a Bowen Center run that way. Like these talented ladies right here, I want them to bring their ideas to the table. I do want to accomplish a certain thing, but how they get there, I'm totally okay with it. Now that's hard for people who've come up through the system, right? I remember I had my hand on the lever, do this, do that. Great. It's not my role anymore. So here's something a little bit of, I've almost called a mantra, is that it may be helpful for you. It really is this idea about things are different, not wrong. And that's been one of the most powerful things for me as a leader to see, is that when someone does it different than you, it's this temptation to be like, no, right? Got married. My wife, she folds towels wrong. She doesn't like the right toothpaste. Oh my gosh, it's terrible. Wrong. No, it's not wrong. You can spend a lot of time fighting over silliness with that, other than saying, you know what, that's not different. It's not wrong. It's different, right? Maybe she'd say, I'd say that it is wrong. So it's not to mean that you don't step in when people cross ethical boundaries. It's not that you shouldn't put edges with things. No one wants to have a supervisor that just do whatever you want. You can give guidance. You can help answer questions. Is there something I can remove as a barrier in front of you? Is there something I can do to help you? But I need you over here, and here's how long I need you to do that. And that idea about different, not wrong is something that resonated with me. So those are really the three things that I wanted to leave with you here today, is that idea about, right, focus on the details, how to delegate like a boss, and obviously authenticity. All right, that's it. Thank you, everybody.